14 hours, 39 minutes. That was a record set on August 6, 1926, by a 20-year-old swimmer named Gertrude Ederle on her second attempt to swim the English Channel. It's a record that smashed the previous one by 2 hours and would stand for 24 years. The previous year, Trudy, also known as Queen of the Waves, attempted this grueling 21-mile swim and placed her trust in a trainer named Jabez Wolf. Maybe not her best choice, since Wolf had attempted and failed to complete the swim 22 times. And he didn't trust that Trudy was strong enough to swim the English Channel. About 9 hours into the swim, Wolf ordered Trudy to be pulled from the water, under his argument that she was struggling. She was not. Trudy bitterly disagreed with this decision, and Jabez Wolf was immediately fired. The following year, Trudy made a new connection when she chose a trainer by the name of Bill Burgess, one of only 5 men who had successfully completed the swim. On August 6th, Trudy set off from the shores of France at 7:08 in the morning, and everything was going swimmingly. Trudy had reporters and her family on the support boat, and even a live band to play show tunes to keep spirits up. But 12 hours into this attempt, the winds picked up, making the water choppy and dangerous. Well, at least for everybody on the boat. But not for Trudy. She was swimming along and having the time of her life, keeping her pace up as the 1923 hit song, "Yes, We Have No Bananas," played on a loop in her head. Burgess, the trainer, panicked and yelled, "Trudy, you must come out." This time she paused, lifted her head, and asked 2 words. What for? Trudy needed a solid reason why she should abandon the swim a second time. When the trainer was unable to provide any valid and convincing reasons, they agreed she could continue, despite the conditions. Trudy went on to be the 6th person and the first woman to complete this monumental feat. Now, let's fast forward almost 100 years to 2020. And along comes this beast, now known to the world as COVID-19. Almost overnight, all of us, healthcare providers and consumers of healthcare, became Trudy and her trainer, only able to react to the present conditions with little to no information to base critical decisions that determine whether patients recover. Do we mask? Which mask? Is it safe to come inside? Vaccine? Booster? When? And how many? How do we maintain meaningful connections and trust with ever-changing guidelines? And as we navigate these murky waters of decision-making, we struggle to determine what is essential to our health and safety. This has become more complicated in our current healthcare system. Despite almost 100,000 scientific articles on COVID-19, there is still uncertainty and debate about the best course of action to treat this deadly virus. At a critical shortage of access to care, and now the healthcare system is really in deep water. And who do we trust when we are like Trudy, dependent on getting sound advice and guidance from those who are leading? In healthcare, there is a concept applied to decision-making called evidence-based medicine. It seeks to encourage, and in some cases, force clinicians to pay attention to the best data. The goal of evidence-based medicine is to eliminate unsound or outdated treatments in favor of more effective ones by shifting the basis of decision-making from a traditional and observational experience to one firmly grounded in scientific and statistical research. Evidence-based medicine sorts scientific studies into 5 levels, ranging from the top level that consists of large randomized controlled studies and systematic reviews that produce strong evidence that a treatment is effective, to what is considered expert opinion from a knowledgeable source, schooled in their field of study, and based on the most current data. Here is an example of evidence-based medicine functioning as intended. For decades, we were all led to believe that cocoa butter was the gold standard in the treatment of scar healing. As an occupational hand therapist, I moved a lot of jars of cocoa butter off the shelves and into people's medicine cabinets. As it turns out, although we did enjoy that vague smell of chocolate, there is 0 evidence that cocoa butter has any effect whatsoever on the treatment of scar healing. This practice is actually the result of an old wives' tale that we told so many times and for so long that we no longer questioned it. Lucky for us, there is now definitive research that the use of good old latex-free, over-the-counter, and alarmingly affordable at 50 cents a roll, paper tape has been shown to be effective in scar healing. Now, healthcare is still at a major disadvantage. Medicine needs to remain grounded in science, while at the same time there are no requirements or standards for the talking heads on TV, the internet, or social media who promote unscientific and unproven opinions. In this ever-changing healthcare arena, healthcare providers will never have all of the answers and sometimes may not have enough data to apply evidence-based medicine. To answer Trudy's question of what for, I invite you to consider a concept I call integrity-based medicine. I define this as, in the lack of sufficient scientific data, the provider uses their clinical expertise, combined with their values, to produce the best possible outcome for the patient. And one of the most important values we can have in healthcare is integrity. That despite tenuous conditions with limited access to data and resources, we will always strive to do what is right. We rise above those commentators and deniers and do our jobs with integrity leading the way. Integrity means following your moral and ethical beliefs and doing the right thing under all circumstances, even when no one is watching. Take hand washing, something that has been proven to reduce the spread of infections and continues to be one of our leading recommendations in our fight against COVID and other contagious illnesses. Yes, doing the right thing, even when no one is watching. In these precarious times of uncertainty, trust that our healthcare leaders and providers are practicing integrity-based medicine is crucial if we are going to reach our goals in tumultuous times. In a paper for the New England Healthcare Institute, Everett DeLon shares that overuse accounts for at least 20% of all healthcare services performed in the United States annually. This translates into $75 to $100 billion a year of wasted money. I believe that integrity-based medicine can help reduce this overutilization of services that are contributing to soaring healthcare costs by encouraging all of us to ask questions, understand the evidence, and mutually agree on the best approach before treatment begins. We can all ask, what for, and take the time to actively listen, which, by the way, has been shown to be a total of 92 seconds. In a 2002 paper by Wolf Langwitz and his colleagues, all it takes is 92 seconds, uninterrupted, for a patient to voice their issues and concerns. It's a win-win. The patient feels seen and heard, trust gets established, and the provider has enough information to at least begin the treatment. As providers, we need to apply integrity to all aspects of care, and that includes, am I reviewing all the options with the patient, including the ways to be as cost and time efficient as possible? Do I have the patient's perspective and wishes included in the treatment plan? As patients, we need to feel empowered to ask questions, voice our concerns, and be honest about how we can be an active participant in the plan. Also, we need to all remember it is okay for all of us not to know the answers, and in some cases not know the questions to ask beyond what for. At every first visit in the United States, patients are provided a document called the Patient's Bill of Rights, which clearly states a set of 15 guarantees that promotes respect for the patient, the provider, opens a dialogue about the diagnosis, treatment, and fees, as well as the delivery of care, including other possible treatment options. This trust between the patient and the provider will determine the outcome, just like it did for Trudy on both attempts, for the failed swim and the triumphant one. And like Trudy and her trainer, we need each other to ask, what for? And then do what is right, put our heads back in the water, and keep swimming until we reach our goal. We all have the power to create sustainable trust by staying true to our value of integrity as patients, providers, and members of society. Trudy's first words after completing this historic challenge were, "I knew it could be done, it had to be done, and I did it." So when you find yourself in uncharted waters, when it comes to your health, who will you trust? And what for? What will you do to make sure we finish this grueling swim? How will you ask? What for? Trust and integrity in healthcare can be done, it must be done, and I know we can do it. Thank you.